Hey guys, Dr. Brad here. And something that I've come to rely on more and more over the years to help my patients with hypothyroidism and associated gut symptoms is the use of probiotics. But to know if they're right for you, we want to understand how they work, what they can help with, and what kinds of probiotics we should be taking. So if you've been considering probiotics to help you out with your thyroid symptoms, stick with me through today's video. And also, if you'd like to support the channel, please like and subscribe. That way you can catch my videos on Thursday mornings and stay up to date on all natural Hashimoto's and hypothyroid healing information. So whenever we're considering any kind of health strategy, we want to understand how it works and what sort of things it can help with. As you guys know, I think it can be a really ineffective way to go about trying to improve our health if we start to become too robotic. Essentially just taking whatever condition or diagnosis we have and automatically matching it to some sort of medication, treatment, or supplement. Instead, we always want to think about the needs of the individual and understand the underlying cause or mechanism of their symptoms. I've said this many times before, but just because two people are diagnosed with hypothyroidism, and even if they have the same symptoms, a lot of times the driver or cause of those symptoms can be very different, and therefore those two people need different types of strategies. Now, when it comes to probiotics, I see a lot of misconceptions out there, and most of the time they're tied to this idea that probiotics are used to seed our gut with some type of beneficial organism. This is the way that I often think about it. If you were going to plant a garden and you select 3 flowers for that garden, they might grow up and you'd say, great, my garden looks good, but I could improve it by adding roses. Since roses weren't part of your original plan, you would want to designate a plot for those roses and plant the roses. Once the roses have grown, you'd then have more flowers in your garden, and because roses are beautiful themselves, you'd have an overall better garden. This is similar to the way that probiotics are presented to us. You have certain types of bacteria and other organisms in your gut, and some might be healthy for you, and some maybe aren't. But maybe based on research or some sort of testing, you could be missing a specific strain that could improve your overall gut garden. And by adding that one strain in, by seeding it in your gut and allowing it to grow, you should then notice better outcomes. And even though that concept makes sense, and I think it's one of the reasons why a lot of people continue to hold on to that idea, it's not really how probiotics work. Instead, we should think about probiotics like putting in fresh, healthy soil in your garden. It improves the entire environment of the garden, and it allows you to grow whatever you'd like. Now, I don't know if that whole seeding idea was just an old hypothesis, but these days, I mostly see it used to sell expensive kinds of testing or leverage a specific claim for a particular type of probiotic or gut product in general. So if someone says that you need to test your microbiome to know what strains you need and what strains you don't, that way you can take a specific kind of probiotic to fill that particular gap, then they're still stuck on those old theories and old ways of doing things. And I've had doctors say to me before, well, I do that kind of testing and I do those kinds of protocols and I see people get better all the time. And in those scenarios, I don't doubt them and I'm sure what they're describing to me is true. People, in general, probably will get better with some of those strategies, but their understanding of the mechanism and what's allowing those people to get better is faulty. And while it's not hurting anyone, they're probably wasting a lot of money on that kind of testing and those specialized probiotics. But like I said, taking probiotics is not about taking some magical strain that is going to give us some sort of superpower. Instead, they are modulators and they affect the entire environment. Research has shown that probiotics can enhance the epithelial layer of our gut. It can block adhesion sites for pathogens. They can break down toxins and produce their own antimicrobial compounds. And finally, they play a huge role in the modulation of our own immune system. To put it simply, they can aid in the healing of our own gut cells, they can reduce toxin and inflammatory burden, They can get rid of harmful pathogens in the gut, and they can help to normalize immune system function. So when I said at the beginning of the video that I've relied more and more on probiotics over the years, this is the reason why. There's so many different positive effects that comes from the use of probiotics, especially in these areas that can be problematic for people with hypothyroidism. And whenever we can use something that affects multiple systems in a positive manner, then I'm usually a fan. But hopefully this makes it clear that it's less about the specific organism that we're using, and it's more about the global effect that it can have. But that then begs the question, if we're not looking for a specific strain, how should we use probiotics? In my practice, I tend to break probiotics down into three main categories. And these are based on all of these categories having a clinical effectiveness to them, each category having a different interaction with our gut, and the availability or accessibility for people to actually get a hold of these probiotics. These categories include, number one, our lactobacillus and bifidobacterium blends. Number two, our bacillus-style probiotics, also known as spore-based or soil-based. And number three, Saccharomyces boulardii, which is a yeast organism that is normally found in our gut. The amount that you'll want to take is going to depend on the category, and different types of organisms have a different type of therapeutic load. When it comes to the lactobacillus and bifidobacterium blend, I will have patients take anywhere from 20 to 100 billion culture forming units per day. For the bacillus probiotics, it's somewhere between 2 and 8 billion culture forming units per day, and the Saccharomyces boulardii is somewhere between 3 and 6 billion culture forming units also per day. But just because we have these different types of soils or gut modulators doesn't mean that all of them are good for your garden. To figure out what's best for you, like we said before, it's not going to be testing. It's going to be doing a trial period with each category of these probiotics, because there is no test that's going to tell us how these things are going to interact with all the other organisms that are already present in your system. Usually, that trial period includes taking the lower amount of each of those categories of probiotics for a period of 2 days. So for the first 2 days, taking the lactobacillus and bifidobacterium blend, for the next 2 days, taking the bacillus probiotic, and for the final 2 days, taking the Saccharomyces boulardii. If you have a negative experience or an increase in symptoms with any of the probiotics, you don't have to continue to take it for the entirety of those 2 days. You can stop early. And it's usually best to put in a rest day, or about 24 hours. That way you give your body a little bit of time to recover and get ready for the next trial period. Some mild gas, bloating, or changes in bowel movements is normal with the introduction of new probiotics, but those changes shouldn't be significant, uncomfortable, or cause a flare-up in any other areas. Once you find the strains that you respond best to or don't cause any negative reactions, then you can use those in combination as part of your health plan moving forward. So if we now know more about how probiotics work and how we can actually introduce them into our lives, are there any specific conditions that we should be aware of that probiotics are especially helpful with? Now, because hypothyroidism is so commonly associated with a decrease in gut function, I often find myself implementing probiotic strategies with a number of my patients. However, just because someone has hypothyroidism doesn't mean that they need probiotics, and because there's always a number of different symptoms that we need to work on, we want to make sure that we're targeted in our strategies and with our supplement selection. Because of that, I always try to look for additional clinical evidence and other conditions that my patient might be suffering with that could also improve with the use of probiotics. And when we look at the research, this can include things like any type of overt gut symptoms like bloating, reflux, or changes in bowel movements, having a health history that includes multiple courses of antibiotics, being diagnosed with IBS or IBD, or struggling with chronic obesity. Additionally, even though the evidence is less clear, I also like to use probiotics in situations where people are struggling with neurological symptoms. And this is even if they don't have some of those classic gut symptoms to go along with it. This is due to the strong relationship between our brain and our gut, and it can include things like people who have had traumatic brain injuries, people who are struggling with depression and anxiety, and people who have generalized brain fog or memory issues. But no matter what way you slice it, just like with our thyroid, changes in gut function, whether good or bad, can have implications for our entire system. And supporting our gut as a whole can allow us to reduce inflammation, manage our symptoms, and continue to progress with our thyroid healing journey. But I hope that you enjoyed today's information, and if you have any questions or have some thoughts on the use of probiotics, let me know down in the comments. Also, if you've been making some changes and working to improve your thyroid symptoms, but feel like you need some additional help and support, and are interested in working with me one-on-one, then send me an email at contact@seattlethyroidhelp.com, and my staff will reach out to you and see if you qualify for a free consultation. During the consultation, we'll chat about your health condition, what your goals are, and what sort of support you need. If I feel like it's something that I can help, I'll let you know, and we can talk about what that process looks like. At the end of the day, we want to make sure that you're in the right spot, and I can provide you with a clear, step-by-step plan to help you get your health and your life back. If you'd rather work on some things at home, you can of course check out any of my other videos on the channel or grab my free downloads listed down in the description box. Those include both my recommendations for electrolytes for people who are following a low-carb diet and the food list that I use with many of my patients who have Hashimoto's. But that's it for today's video. I love and appreciate you guys. I hope you're doing well. Let me know how I can help. If you're liking the content, please remember to like, subscribe, and ring the bell for notifications. And if you want daily information, you can follow me on Instagram or Facebook. Links for that are down below. But my name is Dr. Bodle. I hope that you guys have a great rest of your week, and I will see you in the next one.